introduce to you an amazing healer and friend, and from many years here. Her name is Dr. Catherine Cooper, and we call her CJ. So welcome, CJ, and thanks for coming on and being able to speak with me.
Glad it worked out. Glad to be here.
You know, I know who you are, but just share who you are and what your background is.
I am in my, I think 4th year of practice now. I'm a 2nd generation chiropractor. I know time kind of flies. I still, at times feel like a baby in the field, but it's amazing what you can learn. So, like I said, I'm a 2nd generational chiropractor. My mom is Dr. Terry Cooper. I fought being a chiropractor my whole adolescence, had my own kind of health scare and journey that I'm sure we'll talk about because CRA was a big part of that. That ultimately, like it or not, kind of smacked me upside the head and said, what are you doing? Go be the profession. If you truly want to help people, it doesn't matter what your title is. So that's how I ended up being a chiropractor. And now I work in Cedar Rapids, Iowa. I've started to help take over my mom's clinic. Yeah, we have kind of a multidisciplinary office, but CRA is our main language, I should say, that we use.
Yeah, and that's pretty amazing. And I love the fact that you even say the same language because you're pretty much your entire staff has attended CRA and they know the exact language. If something is going on over here, you'll write it down and the person over here understands and you can pass patients on and everybody understands, which is amazing.
It works very well in that way. I'm grateful for the fact that we do have that common language between providers, but then also between like our assistants. They're usually the ones taking our notes and making sure it gets written down properly for the patient to take home. And so far, the system works very well, but CRA is a very big part of that.
So far, and it's been going on for quite a while, so I don't anticipate changing that. So we're talking about CRA in your practice. Let's get to the part you mentioned a little bit before. How were you introduced to CRA? Why CRA for you?
Yeah, so I would have been just starting chiropractic school, and I went to a actually quantum neurology homecoming. And Dr. Charlie Fagenholz is a good friend of ours, and I was struggling with some health things, mainly kidney related. I had strep infections a lot as a kid, and now we know that causes a lot of kidney scarring. And so my kidneys just were not functioning well, and that was leading to a whole like cascade of other events. So long story short, my mom was like, Charlie, can you just see what you find? I was kind of getting treated by anyone and everyone who would help me. And I was getting better. Like at that point, I would say I was probably, I don't know, 50, 60% better than when it started when I was in like undergrad college. But I wasn't great. I still was like probably 30, 40 pounds heavier of just fluid weight. I would get like really bad like boils under my arms. I was tired all the time. So I was functioning, but I was not like living. So anyways, Charlie checked me and he goes, 10, 20, 90, here's your problem. It's in this, and then go do the SRT belt. And my mom and I looked at him and we're like, did you just speak English? Like, what was that? So that is how we met Dawn, because I then had to go sit with an SRT belt. And then later that night we were sitting at dinner and my mom was like, okay, whatever this technology is, CJ needs it. So you scored it from like across the table. Okay, if you have 1 optimizer, if you have 2, long story short, it was like I still needed a full belt or I was going to have to live with the thing on. So after we bought an SRT belt, I should say, my mom, bless her heart, bought an SRT belt and I slept in it for months. But that was a huge turnaround, as well as the VerVita products. I don't do well with glandulars, and there aren't a lot of supplements that have options without glandular support. So that was a big turnaround for me, being able to really address the kidney component, the SRT, and then the supplement line. And I was 90% better by, 3 months in. I really started feeling better. I just dropped weight. I didn't change anything. And now we're, like I said, 4 years later, and I'm doing pretty good. So
you are. Yeah, I remember meeting you at the QN conference and stuff. And I still remember sitting across the table from your mom, and she was saying, well, we have all kinds of technology. Can you score the technology? And I did. So when I was scoring, and people who are wondering what the world I'm doing scoring, what that is, that's within contact reflex analysis, putting frequencies together and finding out what balances the energy so you can heal. And there's scores. So anyway, I'm figuring out what technology puts things into balance. And it came up that it was the microcurrent and the SRT technology.
My mom was going like to the ends of the earth to figure out what
She
was going on.
was.
So
Her mama heart was
yeah.
going strong for it. But yeah, like you said, it was amazing. A couple months in, and the changes.
Yeah, I would say after that seminar, I think myself, my mom, and our clinical nutritionist all came and like we were sold. Like I felt so much better so quickly, and it really, CRA gives such a good one menu of the tools you already have, but then two, tells you the priority of like how to get there. And we were working a ton of like brain stuff because I had a concussion, and we were working a ton of gut stuff and all of that. But yes, we were doing kidney microcurrents, but I wasn't really doing the right things for kidneys. I was getting better, but not great. So,
yeah. So putting it together.
Absolutely.
When do you remember your first CRA seminar? Because right after that, it was like your mom's going, we're learning this.
Yeah. I remember studying for a biochem test, and Dr. Jordan Bray was like, oh, that's easy. Don't worry about it. Just do this and this. Like after the seminar. But I do remember it. I was like fresh in school. So it was like, I wouldn't say it was over my head, but I was also like sick at the time. So I think my mom and Julie took a lot more away from it than I did, but obviously I went to another one and then started picking it up.
Oh yeah, another one and another one. And I'll tell you that she is one of the first CPCRA certified. So she's certified in CRA, and that's very new. And she was one of them that said, hey, yeah, I want to get on board and help you get that done for people. So it's amazing how you started in college, at chiropractic college. And
so the way that our schooling worked, we couldn't use CRA a ton in school. But it was funny how my friends would all be like, CJ, I can't get over this. Can you test this? CJ, I can't do this. Can you test this? And then of course I had a few guinea pig friends who like wanted their nutrition checked and that kind of thing. So I definitely still use CRA in school. But I'm so glad that I took it before I graduated, because I came out swinging. Like I was ready for full-time practice as soon as I hit preceptor, which was nice.
Yeah,
nice for my mom. She threw me in, but yeah.
Well, she made sure you had tools.
Exactly.
Right?
Yes.
You had tools, not just one, but many tools for your toolbox. So, which is great. So speaking of that, I know your clinic, you have a variety of different techniques that you do, a variety of supplements, different things that you use. How do you integrate CRA into your practice? Right? That's number one. And then number two, why would you recommend CRA to somebody who has a practice like yours? And they're like, I already do so many things. I don't want to do one more. So what would you say to that?
I would say CRA, again, is like our common language. Like it overarches all of our other techniques in that it tells us what is priority in the body, and helps us make a protocol. So we're a very like brain-based. We do a lot of quantum neurology, like I said, and then we do a lot of nutrition at our clinic, as well as technology. So that's just a lot in its own. And so instead of guessing, we truly like will score the heart, or we'll score different reflexes, and we'll ask the body, okay, of these 20 technologies, which one do you need, and where do you need it? How do you need it? How long? Like, how long is this going to take? And a lot of times, like a lot of CRA docs or practitioners, we're not getting easy patients. Like these patients have seen anyone and everyone, and they heard word of mouth to try us kind of thing. And so while I'm not like super new in practice anymore, I still feel confident, even if it's the most wild thing. Like, I don't know, I've never seen that before, but let's score it out and we'll just support your body. And so it gives me confidence as a provider that this might not be, the end all be all in terms of might not make them 100%, but we're at least moving in the right direction. I'm hitting some big pieces to help support their heart or their queen bee or whatever you want to say.
I like to say, putting things on the menu. So you use CRA to figure out, you don't even know what's going on in the body, but the body will tell you. You're using CRA to uncover that root, that focus
Yeah.
But then the cool thing is then you're using CRA to determine which of you had said 20 things, which
Yeah.
of the 20 things do they want?
Yeah.
What's the first thing?
Yeah, and then even like we menu, like our structure menu is very much technique based or technology. Our emotion menu can be different per provider, but for me, like I do two different emotional techniques as well as have like the oils for emotional support. So it really just helps me narrow down what's going to give this patient the most benefit. And it might be more than one thing, but it is amazing what the body will tell you when you ask the right questions.
CRA trains you in asking really good questions. You're only as good as the questions you ask, that kind of thing. But
Absolutely.
you had mentioned, on the menu, the structural menu, the emotions menu, and I just wanted to say that in contact reflex analysis, one of the things that we do is test what we call the triad. It's a sequence, and we want to make sure that the emotions, the biochemistry, and the structures of the body are all in balance because one affects the others. If somebody comes in and through CRA, they're going, okay, there's an emotional component, and they might not even realize it. Maybe they're coming in for lower back pain, right?
Right.
But you discover emotional component on it. And what are the tools you use for the emotional component? What are yours?
I personally use NET, so neuroemotional technique. I'm also trained in QNRT, which is quantum neural reset therapy. So both of those take time and are usually separate appointments in our office. I use NET homeopathies off of NET and then VerVita essential oils. And I would say the more and more I learn, the more I realize emotions are always at the core of issues. So whether people want to admit it or not, there's going to be an emotional component. So being able to have the oils to like do homework at home, whether that's topically or in a foot bath or whatever that may be, there's a lot of power behind that.
Wow, our bodies store these emotions,
Yeah,
and they store
I
them in
agree.
different organs. And my dad, Dr. Versendahl, would talk about how the emotions are stored and how the entire body will twist, turn, subluxate, swell in order to hold up even a tired heart. Or if those emotions can't be released, that body has to twist, turn, and do all these things because of that, because of what we're hanging on to.
Yeah.
Darn
I would
emotions.
say the other thing I've really gotten out of CRA is the analogies from Dr. Versendahl and what you've then taught and brought forward. There's things that like do not make sense. And then all of a sudden it's like, oh, okay, I get it. And so just the way that he was able to download and teach that I think you have taught it in a common way. I don't know if I would have followed him quite as well, but it's quite amazing the way that he could understand the human body.
Oh, definitely. When you were talking about that and how thinking about how the body works in a more common way, do you have something in your mind that you were thinking of that was like, oh, wow, I'm just
I
putting you on
mean,
the
just
spot
like
here?
the heart sequence in general. So, like the first sequence that is taught is all about the heart, or as we say in CRA, the queen bee. And I always say to my patients, yes, we're a very brain-based practice, and we're going to do a lot of work with your brain and your nervous system. But if I don't address the heart first, I'm going to be missing something because, for example, you can technically be brain dead and still alive, but can you be heart dead? And then they're usually like, oh, no. So it's just like that aha moment of why are we checking in with the heart? Like, isn't this just a mechanical pump? No, it's like so much more than that. And I mean, I never realized it before CRA, and then being able to break the heart down even more so and tell a story of what's going on in the body. I think that's really where when you hone CRA is being able to tell the story to the patient and they're like, oh my gosh, I've been to everyone else and yeah, that's who I am. That's what's going on. That makes sense versus trial and error.
Now, another question then, let's go into the VerVita line. Do you have a favorite VerVita supplement or essential oil or favorite for this, but not for that?
So personally, cleanse helped me a ton. And it is one supplement that I pretty much refuse to go off of. Like no matter who checks me, if cleanse isn't in my protocol, I'm gonna add it back in. But I do typically test for cleanse because it really helps incinerate any toxin and debris. And so with all of my kidney scarring, while it is healing and doing much better, Cleanse just really gives me that assist so that I don't feel puffy and toxic. So I really love Cleanse personally. In practice, I typically am using Circutonic often. We have a lot of kids in our practice as well. And for anyone and everyone, it's a very gentle methylator. So if you talk about like methylation techniques and wanting those cogwheels, so if every cell has to go through like 6 different cogwheels, the first cogwheel, if that's not turning, the rest of them get backed up, right? And so Circutonic as well as InspireCell are very good at getting that first cogwheel to turn, versus along down the line becomes more detox. So that's where we would use more like Cleanse or Calms. So I would say I use the most Circutonic just because it's so powerful, but it seems to be pretty gentle. Like people react very well to Circutonic. I do use InspireCell a lot for brain issues or like energy kind of things. Immune Armor has been a popular one this winter with just immune system stuff. So it honestly, it's hard to pick. And I'm glad that I have CRA to test which one they need because it's hands down my favorite supplement line personally, and then professionally as well. You could ask if we printed numbers, I'm sure I sell mostly VerVita.
Awesome. Do you have a favorite essential oil? Do you like using the essential oils?
Yeah, definitely. I personally like to do a bath at least once a week, if not a couple times a week. Heart Harmony is like my favorite just to put on topically, but Immune Harmony, Sore to Sore, those are typically in my bath. Immune Harmony, again, for that kidney aspect and just immune system. Life is a little overwhelming right now in a good way, but, and then Sore to Sore, I typically have some sore muscles from workouts here or there. So it seems to really help calm that down. On a practice side too, like I said, being able to send people home with, okay, not only will this help your back pain if we use Sore to Sore, but this is also going to help again, on that emotional side, which whether we talk about it or not, or do any tea or some emotional technique, I know that sending them home with that is going to help them with some of that emotional processing. So it's awesome that not only it makes you feel better, but it's helping on a systemic level as well. So if we talk Immune Harmony, we're helping the kidneys, we're helping the immune system, but then we hit that emotion too. And there's not a lot of things that do all of those.
That's the power of essential oils.
Yeah.
Because yeah, there's so
Well,
many
we
ways
always
you can use it.
talk about frequency, right? And that's what essential oils are, those certain frequencies that help bring things into balance. So we'll say, okay, your cells right now are singing sharp and flat, like you are not in tune whatsoever. And so this oil is the tune that we need you to sing. So you're going to bring that back into harmony. And same with SRT. I mean, those are similar analogies.
Oh, I love that analogy.
Yeah.
I love that one. Do you happen to have any stories? You know me, I love stories.
I mean, my story is pretty.
Well, your story is amazing.
Yeah,
Absolutely.
I mean, that definitely is a great story. There isn't a patient that we don't do CRA on, truly. Like anyone that comes into our office is going to know what CRA is. They're going to hear us say a bunch of numbers and not understand it until we explain it. But
right.
I would say, so like most recently, we had a kid really struggling with Epstein-Barr. And he wanted to, or I shouldn't say wanted to, he was in competitive swim. And it was like, we did not have much time to get him to turn around. And he was struggling. Like we ended up running labs on him, and I have not seen labs that bad in a long time. Like blood cells were through the roof. And long story short, we used CRA to figure out, okay, what supplements do you need to be on? What technology do you need to use? And he turned around. I mean, I would say he said he was 80% better within a week and a half. And now we're a month post-treatment and he's like 99% better. Like sometimes he has a little dip here and there, but it's just things like that are such, like Epstein-Barr is not a nice virus to have. And to be able to really hit it hard. I mean, he came in for technology 2 times a week and was really good about doing baths at home and taking his supplements. But to be able to turn a virus like that around in probably 2 weeks while he was still competitive swimming was pretty amazing. And I would say those are the stories we get all the time with CRA.
Right. And that's probably why you're going, okay, the stories. I mean, because everything's a story, right? And people might be thinking, well, I have Epstein-Barr, what do I do? Well, you used technology, you used essential oils, you used nutritional supplements. So I don't even want to pretend there's one thing because
Yeah.
CRA put a protocol together for him.
Yeah.
Now, if somebody wanted to even start addressing Epstein-Barr, would there be a VerVita supplement or essential oils that you could go start with this?
Yes. So immune armor is a great place to start. And then often we see Epstein-Barr hit the adrenal glands. So typically we'll add either Regenerzyme Heart or Regenerzyme Adrenal, because again, we kind of talked about those cogwheels of methylation. We've got to get that moving. So probably immune armor, and then Regenerzyme Adrenal or Regenerzyme Heart. Not always long term, but in that short term, we got to turn you around fast. Those are probably what I'm going to be looking at. And then baths in Immune Harmony and like all over you. That's your oil. I think he did a bath with like Elite and Immune. And then I want to say we threw some sort of sore in there as well. So it's nice when you have a practitioner that can tell you exactly what you need, but those would be my go-tos.
So it sounds like that, there isn't just, like I said, one thing for this person with Epstein-Barr. There was a lot of different things, but if somebody wanted to look into it, you named some pretty cool things to start with, getting that body ready to release. But understand there's also could be an emotional component, structural component, as well as the whole biochemical component. But find somebody who does CRA. CJ would be wonderful to do that. So then I know you mentioned something about a story with somebody with concussions. Am I imagining that?
Yeah, so like I said, our practice is very neurological based. And so we do a lot of concussion protocols or concussion syndromes, and no concussion is the same, believe it or not. Like, first of all, you can get a concussion just from like a hard hit falling on your bum, like that can still freeze up your nervous system. And so, along with quantum neurology, we'll use CRA to support the body. Again, what nutrition do you need? A lot of times we're using InspireCell and Calms with concussions. What oils would you need? We're going to think probably more along the lines of sort of sore or present moment is very good for the nervous system. And a lot of times Elite Harmony, just Elite is great for chaos. And a lot of times concussions can really knock people out and just cause chaos, not only through the body, but in other areas of their life as well. Hands down, there is always emotional components when it comes to concussions. A lot of times that's not looked at in other practitioners' offices in terms of they can do a lot of eye tracking and eye exercises that are powerful, but if you don't hit that root of the emotion, there's usually something lingering there. So we honestly see concussions all the time, and it's typically high school students, and they turn around really quick and don't have issues later on. It makes me laugh when my patients come in and they're like, I got hit with the volleyball. I need to be checked for concussion today. Like they know what to ask for, kind of thing. And it's good. And what we find is that when they are supported and then they do have an injury of some sort, we can just bring them back from it a lot faster versus having to like rewrite the whole thing. But we had one MS patient that was pretty cool where she came in and couldn't move anything of her left arm. And so that was one of those moments of like, well, I've never dealt with this before. Like, I don't know what I would do. And so I just used CRA to ask, figured out where her heart scores were. We started her on nutrition that I'd have to look back and see what it was, but I'm going to guess InspireCell, and I think we actually ended up putting her on cleanse as well because she had just had a recent vaccination. And then we did a lot of SRT therapy, like systemically around her. And then the body also led us to do quantum neurology on the arm. And and there's always emotions, right? But before she left the first day, she couldn't lift her whole arm up, but she was at least had movement in her hand. And then when I saw her 2 days later, hand was like above her head. So that was a really cool story.
There's so many cool stories, and it just makes my heart go. When
Yeah.
people
I
are
mean,
helping.
just being able to, again, it's all about asking the right questions. So with her, I didn't know what was wrong or why it wasn't working in terms of, okay, she has an MS diagnosis, but something's still not firing correctly. And so as we start to go through the triad and the heart sequence, and we narrowed it down pretty quick of how to remove that interference and let her be able to move her arm.
So even if somebody says, well, you can't heal that. So just because there's a certain diagnosis that, nope, incurable, you have to live this way the rest of your life. Give it the thing that it needs to bring it back into balance so that it can do what it was created to do. And you're seeing that all the time in your practice.
Yeah, absolutely.